Hello, good evening once again.
Good evening.
Good evening.
Good evening.
Can you hear me?
Good evening.
Yeah, we can hear you, Grandpa.
Hello.
Hello, we can hear you. Good evening.
Hello, can you hear me, please?
Yes,
Yes,
Doc,
Doc,
we can hear
Yes,
you.
we can hear you.
Hear you loud and clear.
All right, ladies and gentlemen, so we are starting off and we see what we can do today. If you are not hearing me properly, please alert me because I seem to have a challenge from my end. And if anybody has any challenge hearing me properly, please let me know. All right, so I'm trying to move my slide, it's not moving. All right. Okay. So we go. So as you know already, this is a certificate course in andrology and seminology. I'm going to be a lecturer, Thomas Jampoma. Right. So lecture one today is going to be just introduction. We tried to do a little bit of it the last time we met. So this introduction to basic andrology. All right. So the key objectives of this course is that we want to provide you with basic and advanced body of knowledge and skill set, which you can use as the standard for performing semen examinations, not only for semen examination, but for andrology laboratories. The other day I was trying to just explain the difference between andrology and semen analysis, or for that matter, semen examination. As you move along, you see that andrology is broader than the semen analysis. All right. So you're going to have that body of knowledge, which will help you even to establish not just semen analysis bench or semen analysis laboratory, but andrology laboratory, where it goes beyond semen analysis and very complex and sophisticated tests. All right. So that's what our main objective. Right. So this training will give you the adequate knowledge set, which you can use to assess and interpret parameters of the male reproductive function. What it means is that once you have a body of knowledge, okay, even if somebody does something, a test, which you didn't do, you can look at the test and say that no, I mean, this test doesn't match. Or you can use the test to explain what is likely to happen to the patient and probably also suggest further investigations to come out. Because well, we are just
Grandpa, please, you're not sharing your screen.
just
We can't see your slides.
male infertility. You're going to do a lot more in the area of diagnosing andrological disorders. Right. So what will be our expectations? Our expectation will be that you gain that comprehensive understanding of the physiology of the male reproductive system. As you move along, you're going to find andrology, and you see that it's virtually nothing but the male reproductive health. All right. And so everything about it. So you need to gain that kind of understanding of how the male reproductive system works. What makes up the male reproductive system, the functions of it, the conditions that can affect it, and for that matter,
Hello, Doc.
how to manage.
Should I add more? Are you okay?
Hello, Doc.
Hello, can you hear me, please? Can anyone hear me?
We can't see your screen.
Yeah, we can hear you.
Okay, so Grandpa has a challenge. He has a challenge, so he's going to send me the slide, so I will project it.
Okay.
So let's be patient. It will be uploaded.
Okay.
Sorry, I'm told that you can see my slides, so I'm going to send them to the coordinator for him to do the rollout. Sorry, give me some 2 minutes to do that.
Come and push.
Okay, so thank you very much, coordinator, and very, very sorry, you know, the grandpa is always a grandpa, and it's like technologically challenged. So please forgive me on that. So we roll on. So please move to the next slide. All right, so next slide, please. Right, so we're saying that we're just going to do the basics of andrology. And we said that before we move to the SIM analysis, you have to get an understanding of what is andrology, and then we can appreciate the program very well. So our objectives is also to provide you with that, not just the basic knowledge, but even advanced knowledge and a skill set. The skill set is going to be the technical aspect that will help you to be able to actually operate the procedures in a standard manner, okay, so that you can perform a SIM analysis, not just SIM analysis, but all andrological procedures or diagnostics. So you see that you can have what we call andrology laboratories, where you do not just SIM analysis, but other diagnostics that can also help to diagnose andrological disorders. All right. So we're going to, so the second objective is to provide a training and adequate knowledge, of course, that will help you to make assessment interpretation of parameters. So what it means is that even where you have not done the test, you can just get somebody's results and now can advise, you can interpret based on the body of knowledge that you have. All right. So our expectation is to gain a comprehensive understanding of the physiology and diseases of the male reproductive system, of course, including infertility and common andrological disorders. You appreciate that andrology is all about the male reproductive health. So anything that can cause a malfunctioning will fall under andrology. For that matter, our side as laboratory scientists is to help in the diagnosis. All right, but it doesn't end there. If you diagnose, you should be able to treat. That's why basically andrology is basically a subspecialty of medicine. All right, so because it goes beyond just the diagnosis, it includes treatment. And of course, you and I know that treatment is not part of our portfolio. And so ours is to help with the diagnosis. All right, so move on. Are we getting them in the slide mode, or just because I'm seeing it in? All right, thank you. All right, so the next expectation is that when the knowledge and skills that you are going to acquire, when you adopt them, because it's not just acquiring knowledge and just keep it aside, but you should be able to adopt them and practice them in your laboratories. When you're able to do that, then it means that you can be assured that the quality of SIM analysis that you perform will be significantly improved. Once that is done, you are doing it properly, somebody is also doing it properly, another person also doing it properly, then it means that you can have what we call resource comparability, because what lab A is doing, the procedures being adopted by lab A, the same thing that's adopted by lab B, let's say in Avrongo, is the same thing that is adopted by somebody in Tema, understand? So that once all of us are doing the same thing and correctly, then we can compare results. Otherwise, you go and do your, let's say, SIM analysis in lab A, you go to lab B somewhere else and give you different results because the procedure that is being adapted is different. So this kind of training is to give all of us that kind of quality of knowledge and skill, which when we apply them in our laboratories, will not just improve our quality of the analysis, but also allow for comparability of results. Please move on. Right. So, like we said earlier in the publication, we will continue even after the training to provide technical assistance for you to be able to set up not just SIM analysis bench, but also andrology laboratory. Like we said, andrology goes beyond SIM analysis. And as we move on, you see what kind of diagnostic procedures are available for andrology disorders. So you can establish andrology laboratory, not just semen analysis bench. And we are going to make ourselves available to provide that technical assistance for you to be able to do that. Of course, like we also publicized, we're going to enjoy remote support through Andrology Seminology Network, because this program is going to, because it's under the university now, we're going to go ahead and then establish it in a manner that it's going to be like, it's going to be standardized. All right. So once all of us now we are in this program, we are becoming like a network. We become like friends. All right. When you have a problem in your laboratory about some results, you don't need to call Grandpa. You don't need to call Dr. Latif. You can call any of your colleagues, because you have become a family. And that's what we're going to do, so that we can support each other. And now, as we go through this training, like we said earlier, you yourself, you will be a trainer of trainers. All right. So now you can, because the certificate is now coming from the university, it means that you can be recognized as somebody with high expertise in andrology and seminology, and therefore you can train others at any level of the cadres. Please go on. So now, by introduction, we're going to look at what is andrology. We're going to look at the male reproductive anatomy. Then we're going to look at the key elements of the male reproductive system. All right. Then we're going to look at the male reproductive physiology. Of course, all back in school, all of us know about anatomy and physiology. All right. So anatomy are the parts. And then the physiology is the functions, what role they play. And then pathophysiology is that the function they play, if something goes off, if there is a malfunction, then it becomes pathological. So the physiological, the functioning has become a disease. So that's what we call pathophysiology, pathology, disease conditions affecting the physiology or the function. So you're going to look at all those sort of things. And then you appreciate that once you understand all those things, then you'll be able to now look at what methods, what procedures, what tools can be used to actually diagnose the kind of dysfunction that you're talking about. Right. Next. Right. So the andrology itself. Right. So the term andrology is coming from the Greek word called andros. And then I was just explaining the andros, like you are pulling somebody's dross. I mean, the ladies will not do that. It's the men who will do that. So andros is just about male. All right. And like I was saying that when we're talking about male, we are not talking about the personality male as in a human being standing there. The big difference between a male and female is in the reproductive system. All right. So when you're talking about andros, you're talking about, it means male. You're not talking about male as a person. You're talking basically about the male reproductive system. All right. And then, of course, you have the suffix. So you see that you have two words there, andros and then the logi. And the andros is coming from a Greek word which means male. And then the suffix logi, all of us know this one, basic. That logi means the study of. All right. So when you say oncology, you say that the study of this kind of disease or condition. All right. So the logi is the study of. So once you combine them, they become the study of. Then you know that the andros is the male. So it is the study of male. And we are saying here that the male is actually the male reproductive system. So it becomes the study of the male reproductive system. That's all. All right. And now you are not just looking at the system, but you are looking at its functions and the disease that can affect it. So incomprehensibly, andrology is a branch of medical science that deals with the study of the male reproductive system, physiological and pathological conditions. So we are not looking at the system, the anatomy of it, but we're also looking at the role they play, the conditions that can affect their role, pathological, everything combined. So that's the broad spectrum of andrology. All right, good. So straight away, you know that it covers a wide number of conditions. Any condition that can affect the male reproductive functioning is part of andrology. All right. So, of course, the key areas talking about the male infertility, talking about sexual dysfunction. Here, sexually, you're talking about, for the male, you're talking about the penis. So if you have a penile problem, if you have problem with the erection, of course, all those things, I think, apart from male infertility, one of the biggest problems affecting men is about erectile malfunction or dysfunction. All right, so all this is fall under an andrologist. If you have an andrologist, that is his or her specialty. Then, of course, the genitourinary disorders, because we said that when you're looking at the reproductive tract, all right, it's about the genitals, all right. For the male, you see that a lot part of it, the same organs that are connected with the genitals are also connected with the urinary system. All right, so you see that you are having a dual function there. So that's why you have the genitourinary system. So it doesn't mean that it's the same thing. If you talk about the penis, as you move along, the penis is used for sexual activity, which falls under the reproductive system. The same penis is used for urination or maturation. So it is the same thing. So when you talk about genitourinary, talking about the same thing, which is performing two functions. So anything which is affecting this disorder will all naturally have to be treated by andrologists if you have it. All right, please let's move on. Please don't hesitate to draw my attention if there's something that you want better explanation. All right, because you just want people to appreciate and actually understand the whole concept of this course, so that it is not like something that you can just go and read. It's something that even if you don't read, through this discussion, you will be able to get a lot of understanding that can be part and parcel of your knowledge base. So then you're looking at the male reproductive anatomy. You realize that if you want to look at the conditions that affect the male reproductive system, everything, then you must know the anatomy very well. You must know the structures very well and what role they play, so that you will be able to appreciate the conditions that affect them. So the knowledge of the anatomy and components of the male reproductive tract is important in understanding the basic and thorough, in developing a basic and thorough understanding of the whole system. It's like before you can understand andrology or semen analysis, you should be able to appreciate the components of the male reproductive anatomy. Again, the male reproductive system consists of several, you know that, I mean, basically, systems are made up of organs. Organs are made up of tissues. Tissues are made up of what? Cells. All right, so once it is a male reproductive system, then it means that it's actually made up of organs that will act together to perform a certain function. So that is all. So we know this from our basic, whether you did, even if you did, you didn't even go to tertiary school, right from secondary school, you are taught that systems are made up of organs. Organs are made up of tissues. Tissues are made up of cells. So once you're talking about male reproductive system, then you know that it's made up of several organs that act together to produce the functions that you're talking about. All right. So now you know that the male reproductive anatomy is all about how that system can produce sperms and transmit that sperms to the female. It's all the part of the function. So you know, if you have a factory and you produce, let's say, rice, and then you don't have any means of transporting it to the market, then you haven't completed the cycle. All right, so you can't just produce sperms and not have a means of transporting it to where it has to perform its work. So the means of transporting also becomes part of the male reproductive system. So it is not just producing sperms, but also delivering it to where it matters most, and that's to the female reproductive tract. Right. Let's move on. Right. So this is just a schematic representation of the male reproductive system. Of course, you have a penis. I'm sure you can appreciate this picture. It's very clear, very, very, very clear. You have the penis, and then within the penis, you have the urethra. Of course, you have your testes. You're going to take all these things one by one and describe them thoroughly. All right. So this is just a schematic view. So look at it properly, and as you move along, you can appreciate them. All right. Move on. This is a better pictorial representation of the male reproductive tract. For here, you are including scrotum. You are going to look at all the scrotum, testes, penis. You are going to take all of them one by one. I just want you to have an overview of the male reproductive system. Okay, so look at where the scrotum is, look at the testes, look at testes being spelled T-E-S-T-I-S. You're also going to look at testes which is spelled T-E-S and the T-E-S. And the difference is that, scrotum, sorry, the testis appears as a pair. All right, so when you're talking about one of it, or the singular, it is T-I-S. If you're talking about testis, you spell it as T-E-S, then it means that you're talking about testis as a pair organs for the male reproductive system. So that's all the difference. Testis T-I-S and testis T-S. T-S is double, of course, and then T-I-S is singular. All right. So let's move on. I'm sure you are looking at the pictures and notifying. This is a better, a more comprehensive overview of the things that you've been saying over and over again. So you have the urethra, the skin, the glans penis. That's the end of the penis, okay? And then the urethra, the tunnel. You're going to talk about all these things one by one, so don't worry. And just have a look at the picture so that you can appreciate where each one is. All right, move on. And please don't hesitate to draw my attention if I'm going too fast. Two, if you don't understand something. All right. Good. So like I said, you're going to look at the key elements. The key elements. So for today's lecture, you're going to look at what we call the external male reproductive organs. So most of the male reproductive system are located outside the body. Okay. So because they all belong to the male reproductive system, and some of the organs are outside, you call those ones that are outside, we call them the external male reproductive organs. All right. Or some people refer to it as external genitalia. So external genitalia is not one. Sometimes people make that mistake. When the genitals is the male organ, or for that matter, the penis. But if you are talking about external genitalia, everything that is part of the male reproductive system, which is outside, becomes part of it. And so, for example, the scrotum is outside. It is part of the male reproductive system, and therefore it is part of the external genitalia. So those are some small things that you ought to notice, so that when we come to small quizzes, you didn't say, when they talk, when you are asked to identify external genitalia, you don't just see the penis as the external genitalia, the scrotum, the testicles. And over here, I also want you to look at something. The third portion, we're talking about testicles. Testicles is one of the commonest words that you hear from most people, rather than testis. Remember, I've told you that testis, if you spell it with one TIS, talking about a single organ. Okay, one of it. And you know that all of you have two. You also have the epididymis. If you spell and you look over here, you ending with MES. Epididymis is also structures that are tied to each of the testes. So once it becomes two, then it is the plural. So when you spell it with NES, you're talking about the two organs that are attached to the pair of the testes. So those are small things that sometimes in writing we make those errors. Now, a lot of people, when they're saying testes, when they say testicles, they're talking about the testes. But technically, as we move along, I'll explain. Technically, testis is that exclusively that organ without the epididymis, because epididymis is also on its own. But because of the close attachment of the epididymis and then the testis, anytime talking about testis, the epididymis comes into mind. So testicles was actually used to describe the combination of the two, the testis and the epididymis. All right, so just want you to know that invariably as scientists, you can write testis and read the testicles for the ordinary person in the street. All right, let's move on. Good. So one of the major external genitalia is the penis. So if a man is a man, he is a man because he has a penis. All right, and remember we said that the male reproductive system, talking about your maleness, okay? And your maleness is about the fact that you have a penis. Not just the penis, but all the other things that make up the reproductive system of the male. So we're going to handle that one first. It is simple because all of us know about it, but look out for certain terminologies. All right. So the penis is the male organ for sexual intercourse. Sexual intercourse is called copulation. And for that matter, because sexual intercourse is called copulation, and the penis is the means by which you do sexual intercourse, you also call the penis a copulatory organ. So those are that's the second point. So the penis is used for sexual intercourse. Sexual intercourse is technically called copulation. So the organ that you are using to achieve that purpose becomes the copulatory organ. Okay, and then the same penis is also used for urination. And urination, I'm sure a lot of you know that it's also called micturition. So whichever way you look at it, copulation and micturition. If you want to be very, very technical, you say copulation. If you want the ordinary man in the street to understand, then you can say sexual intercourse and urination. So the same thing. All right. So, of course, apart from the pleasures, the penis is the organ which is used to deliver spermatozoa to the female tract during sexual intercourse. So that's why I say that the whole essence of the reproductive system is to ensure that the male that produces the sperms delivers it to the female. And it is this penis which will do that transfer. So it becomes the means of delivery of the spermatozoa. It is very, very, very important. So if you produce your sperms and you can't deliver it to the site where it is needed, then, so if you don't have a penis, then it becomes problematic. All right, so that is it. Remember we said that the once you are moving the sperms from the male to the female, you want as part of the reproductive functions. And then the same penis is also used for urination. So remember we said that the reproductive system, the organs involved are the genitals. And then of course you also have the urinary system. So once you have this organ, which is the penis, able to perform those functions, then it is performing a function for the genitals, also performing function for urinary. So you call it genitourinary. Now, it can be used for urination and then sexual activity, or sexual activity and urination. So whichever we look at it, if you want to put the genitals first, they become genitourinary. If you want to put the urinary first before the genital, then you also become urogenital. So it's the same thing. So now the penis can be described by 3 terminologies here. One, we said that it can be used as a copulatory organ. We also say that it can also be said to be genitourinary organ. It can also be as the urogenital organ. So don't get confused. Don't get confused. The same thing depending on what function the penis is playing over here. Please, let's move on. Right. So now the penis can be anatomically divided into 3 parts. All right. So you have the root, that is the part which is affixed to the body. All right. So you have where you have the yellow, look at the diagram, the part which is fixed to the body, that's the root. And then the body itself, which does the action, that is the body. So that's also, of course, a shaft. When we talk about a shaft, I'm sure all of us know what a shaft is. All right. So it is also called a shaft. So we have the body, so the root have the shaft, and then the end. You know that portion which ends, and of course usually bulging type. So that's the glans. So you can call it a lot of times called the glans penis. All right. So that's the end of it. Remember when you say the distal, talking about the last end. Okay. When you talk about posterior, that's the far end. When you talk about anterior, it's also anterior is just also like the distal. Anterior is the front end or something like that. So there are certain basic terminologies in medicine which should not confuse you. You should get them the understanding straight away. So you have the glans penis, you have the shaft or the body, and you have the root. Very, very, very simple. All right. Of course, you are not going to go into the sizes and the length and stuff like that. No, we're not going to do that for now. So let's move on. So one major thing about the penis is the tract, the tunnel, which is inside, which all of us know as the urethra. So the urethra is the tube that carries the urine from the bladder and also carries the semen from the prostate and ejaculated ducts out to the tip of the penis. So the long and short of it is that the urethra is the means by which urine is carried from the bladder to the outside. And of course, semen is never carried from the bladder. Semen, from wherever it is being produced, comes into the prostate, and then we have it being sent outside the body. All right. So that is the, and of course it's the penis that houses the urethra. Okay, right. So here you see that the urethra is the final passageway for both urine and sperm to leave the body. And like just as we talked about the penis as the urogenital or genitourinary organ, here we're talking about a tract. So since the tract is also playing a dual role, you can also call it as urogenital tract or genitourinary tract. As simple as that. These things are so fundamental and basic. All right. So let's move on, say. Right. So more about the urethra. So with the urethra, you know that it starts from the bladder neck. You know, when you talk about it, when you know where the bladder is, I'm sure you can see it from the picture here. The bladder is immediately after bladder, the opening out, okay, is part of the urethra. So from the bladder neck coming out throughout to the end of the glans penis becomes that is the urethra. And you appreciate that the tract can be classified based on the structures through which they are passing. For example, the urethra is starting from the end, the neck of the bladder outside, and then it is straight away after the bladder, it's passing to the prostate. So it means that the organ or the tissue surrounding the urethra at that point can be called the prostatic urethra. So the whole urethra is starting from the bladder, the neck of the bladder to the outside. But you see that it's passing through certain stages or is being enclosed by certain tissues or organs. So we just try to associate that organ with the part of the urethra. So since the urethra here is passing through the prostate, that's why it's called prostatic urethra. All right. And then, of course, we have a membranous urethra. Immediately after the prostate, the membrane there, the tissue there is so soft. And so because it's so soft, that small portion is called membranous urethra. Okay, before it enters what we talk about the shaft, okay, the penis itself. So within the penis itself become the penile urethra. So very simple, very, very simple. The urethra, you're talking about it passing through the prostate area, so it becomes the prostatic urethra. We're talking about a membrane immediately after the prostate before it enters into the shaft of the penis itself. And so that becomes the membranous urethra. And then the shaft is the penis itself. The body of the penis itself, the urethra there is called the penile urethra. Very, very, very simple. And of course, the opening, which allows the urine or the semen to come out, is called the meatus. M-E-A-T-U-S. Whenever you have a meatus, it's opening, okay, or orifice. So the urethra, the opening is called the urethra meatus or the urethra orifice, or whatever you call it. All right. Now look at the far right of this picture. You're going to see stratification there about the lining. Very good. Thank you, sir. So you see that when you are doing urine analysis and you are seeing a lot of squamous epithelial cells in the urine, you will not think that it is from a male urine. So you will not think that that particular specimen is from a male patient. You know why? The reason is that in the male, look at the urethra, because the urine is coming from the bladder through the urethra outside. Now, the glans penis area, okay, it is just the I don't know how to explain it, but you see, the skin itself is the skin, the normal skin is covered by stratified squamous epithelial cells. This ones we know from basic anatomy. All right. Now, the tip of the penis or the penis itself is also covered by skin. The tip of it the epithelial cells that lines the outside does not end at the tip. Whenever you have one stream of epithelial lining, it doesn't end abruptly, moves gradually, and then another one also merges. So that's how it is. So when you have the squamous epithelial cells at the glans penis, that is the end of the last portion of the penis, the skin. It doesn't end at the meatus. It doesn't end at the tip there. It has to move in a little bit. So it means that the glans penis area, yes, that area is like in continuation with the skin, the skin of the body, and therefore that is stratified squamous epithelial cells. So if you have stratified squamous epithelial cells, you know that the skin, before the skin can peel, it means that there should be rigorous, how do you call it, scratching before something can peel. When you have stratified squamous epithelial cells, it will not just peel off straight away. So it means that when you are urinating and the urine is coming out, you are not, the urine is not going to be able to pull off the stratified squamous epithelial cells and let it be part of the urine. Okay. So, however, if you're talking about the female, even though the urethra is not part of the vagina, all right, but the urine is coming from the urethra, and normally when the woman is menstruating, is weaning, it comes along with a lot of the vaginal secretions, right? And you know that there's what we call desquamation, squamous cells, and then if you prefix it with D, become desquamous. So that's why we call desquamation. And desquamation is removal of squamous cells. Remember, the word D means removal. Okay, when you have medical terminologies, this is, you know them already. DE means removal. So if you say dehemoglobinization, you are removing hemoglobin. So desquamous means you are removing squamous. And then the action of that removal becomes the desquamation. So when you say desquamation, it is talking basically about the removal of squamous epithelial cells. This is a natural phenomenon in females. The female vaginal lining is squamous epithelial cells that are constantly being shed off. All right. And once they are constantly being shed off, they become, if the woman is urinating, become part of the urine. So if you are seeing a lot of squamous epithelial cells in urine, it will be difficult for you to assume that it is a female urine. Sorry, it will be difficult for you to assume that it's a male urine, because per this structure, the urethra, the urethral meatus area is covered by squamous epithelial cells, which is just like the skin. And so you are not going to get squamous epithelial cells moving out. Immediately after the squamous epithelial cells, you are going to get stratified columnar epithelial cells, which also don't move, they're also stratified. They don't also, what they call it, they are also not removed. Okay, so you are not going to get it, even through the penile urethra. Stratified squamous columnar epithelial cells will not be moved. The urethral meatus area, which is the stratified squamous, will also not be moved. Okay, and then you are going to get the up there from the prostate is also in continuation of the bladder, and so the bladder is lined by urothelia. You know, the transition epithelial cells, which we also call the urothelia because of the urinary tract. Okay, so urothelia. So, and urothelial cells sometimes will move out because they are transitional. Because they are transitional, they keep on changing their shapes and then they'll fall off. So when you are getting epithelial cells in urine, normally they may be urothelial cells coming from the bladder area. All right. So those are the understanding that you should have so that you can explain certain things. So I'm here saying that if you look at the male urethra, squamous epithelial cells that are even at the last end, the urethral meatus area,
Hello? We lost him.
Sorry, I'm sorry. I went off. I don't know whether it's from my end or from the other's end. Sorry. So you're going back. You're just taking a look at the male urethra. And I'm seeing that if you have an appreciation of the structure of the urethra, it can be used. Remember, we said that the urethra is urogenital tract, just as the penis is urogenital organ. Because it's urogenital tract, it means that it can be used to assess urine. It can also be used to assess the semen. All right. And I'm just saying that you can look at urine and then quickly conclude that this is a male urine or this is a female urine. This is no magic. You're only applying the concept of the anatomy of the urethra. That when you look at the urethra, the male urethra, from the neck of the bladder to the outside, all right, we have three portions there. And the portions are the prostatic urethra, the
Hello, is he off again?
sorry, I don't know what's happening. All right. So, sorry once again. Coming back, we're saying that the urethra at the lining of the urethra at the glans penis side is by stratified squamous epithelium, which is like a continuation of the skin. So the skin, as the penis, of course, has the skin, and then at the end, the uterine matrix doesn't end abruptly there. It has to move in a little bit before it gives way for the next line of the epithelial lining. So that place is stratified squamous epithelial cells, which is just like the skin. And therefore, even though they are squamous epithelial cells, when you urinate, they will not come out. Then their continuation there is the pseudostratified or stratified columnar epithelial cells. Columnar epithelial cells don't move. They are very stuck. And so they will also not move. And then we move up there, you can get occasionally you can get some prostatic, after the prostate area, because of the changes there, you can get some few epithelial cells there. But those epithelial cells are also part of the epithelial lining of the bladder. And so they are uterine cells. And I've said over and over again, uterine cells are what we know as the transitional epithelial cells. Transitional because they keep on changing their shape. So if you have urine and the epithelial cells, they are invariably, about 90% of the time, they are uterine cells coming from the bladder and not coming from the urethra. When it comes to the female is lined by simple squamous epithelial cells, which usually keep on removing by naturally. We call it desquamation, the removal of squamous epithelial cells, which it is termed as desquamation, desquamous removal. So desquamation. So because of that natural phenomenon of epithelial cells lining the vagina continuously being removed naturally, then it's natural that they will be part of the urine if the woman is urinating. So if I have a urine and I'm examining, I'm seeing a lot of squamous epithelial cells, I mean, naturally, I know that it's a female urine. That's what I'm saying here. And I'm bringing this one here because we're saying that the urethra is a urogenital tract. So it is both used for the genitals, which is the semen, and it's also used for urine. So we are not off track when we mention some of these things. All right. Okay, let's move on. I think we spent so much time here. So please move on. All right. So now we're looking at the scrotum. Because all of us know the scrotum, and that is the skin or the sac. It's like a pouch that is located under the penis. In fact, between the penis and the anus. That's where you have the scrotum. It consists of a skin and subcutaneous tissue. When it says subcutaneous, that is like a tissue that is medially after the skin. So it's like after the skin, the tissue just underlying the skin is a subcutaneous tissue, right? Now, so I'm sure all of us, a lot of us are males, and even those who are females, all of you have seen scrotum before. It is like two things, and there is a partitioning. All right. So that is vertically. So there's a vertical partition, and that partition is called septum. You meet this septum somewhere, so you have to take note about it. So a vertical partitioning or septum of the subcutaneous tissue. So it means that it divides the scrotum into two parts, and each one contains a testis. So you see that the testis here, TIS. All right, so because we're talking about each, so each testis. Now, so the function of the scrotum is to house and protect the testis. All right, and the major thing is that it tries, as you move along, you see that it performs a peculiar function of trying to not just protect the testis, but also maintaining the temperature of the testis at a temperature below the body temperature. Now, all of us know the body temperature to be around 7. Now, the testis will have to perform optimally at a temperature of around 34, which is about 3 degrees lower than the body temperature. And so there's a mechanism that is manifested by the scrotum to try to regulate the temperature of the testis in a manner to ensure that it's always around the optimal temperature for its function. I hope I've made myself clear. All right, let's move on. So now the scrotum has two types of muscles. One is called the cremaster muscles, the other one is called the dartus muscles. Now it is these two muscles which control the position of the testis within the scrotum, and they can also function in a manner to ensure that the testis is always maintained at the optimal temperature that we want. Let's see how it goes. The dartus muscles is subcutaneous. What it means is that it is attached to the scrotum, so that if the skin of the scrotum, you know, the scrotum itself is a skin. So the muscle which is directly after the skin, which is the subcutaneous, is the dartus muscle. Okay, so this dartus muscle, what it means, so those of us who are males, you see that sometimes you see that your scrotum is wrinkled. Sometimes you see it as smooth. Okay, you explain all these things. So it is this dartus muscle which is either contracting or relaxing. If it contracts, now of course it will cause the scrotum, the sac, to shrink. Okay, once it's shrinking, then of course the whole sac becomes wrinkled. And as we move along, you see that once it is wrinkled, it means that it becomes smaller. Once it becomes smaller, it means that it is not allowing heat. It is not allowing too much heat to move out. I hope you are getting the point clear. So we have the sac. The sac, the muscle which is attached to the skin of that sac, which is the scrotum. That muscle is the dartus muscle. And I'm saying that it can contract. As it contracts, if it contracts, then it makes the entire scrotum smaller. Okay, once it makes it smaller, how does it make it smaller? It makes it smaller by contracting. Once it contracts, then the entire sac becomes wrinkled. So when you have your scrotum wrinkled, what it means is that the dartus muscle has contracted. Once it has contracted, it means that probably the environment is cold. If the environment is cold, then if the scrotum doesn't do that, it means that the scrotum, the temperature there is going to go below the 30. Remember, we said that it should be about 3 degrees lower than the 37, which is around 34. But it can be so cold that it can go beyond close to say 30 degrees. And that 30 degrees will cause the testis to malfunction. So what it does is that the dartus muscle will contract. If it contracts, then the scrotum becomes wrinkled. Once the testis becomes wrinkled, it means that it's reducing its surface area, and therefore it will not allow heat to be lost. Once it doesn't allow heat to be lost, it means that it is retaining the heat, and for that matter, not allowing the temperature to go lower than the expected. So that is a kind of principle that's adapted by the muscles of the scrotum. So, like I said, so when the dartus muscles contracts, the scrotum becomes wrinkled. Once it's relaxed, it becomes smooth. So take note, those of us who are men or our ladies, the next time you hold your man's scrotum and you see that it has wrinkled, it means that the man is feeling cold. Okay. Once it has become smooth, that means it means that the body is feeling hot, something like that, and therefore the scrotum will have to be relaxed. that muscle had to relax, and therefore increasing the surface area of the scrotum so that it can allow more heat to go off. Then it can maintain its temperature. So that's about the datus. The datus is subcutaneous. What it means that it is linked with the skin. So if it relaxes, it is either making the scrotum either wrinkled or smooth. That's all its work. Let's move to the next slide, please. Good. So we are going to talk about cremaster. The cremaster is rather attached to the testis. All right. So we said that the datus is attached to the skin of the scrotum. Now, the cremaster is also a muscle which is attached to the what do you call it? The testis. It is coming from the abdomen. As you move along, you realize that the testis actually develops in the abdomen. So once at the time of descent, at the time that this is descending, there is a muscle that is pulling it, causing it to come down. Okay, so that muscle keeps on protecting it. So the cremaster muscle is actually emanating from the abdominal wall. All right, and it's also actually protecting or holding the testis in the scrotum. So it means that the cremaster, listen, if it contrasts, it will pull the testis and not the scrotum itself. Remember, I said the scrotum, the datus muscle is attached to the scrotal sac. Okay. Now, then it will either make the scrotum wrinkled or smooth. And then the cremaster muscle is actually the muscle that controls or that keeps the testis in the scrotum. So if it contrasts, it means that it will pull the testis up. If you pull the testis up, what it means is that it's causing it to come closer to the body. If it relaxes, then it means that it is now also lowering the testis to move further away from the body. So you see that you are having the cremaster muscle and then the what do you call it? The datus muscle. They can work in a synergy. They can work together in a manner either to pull the testis up or down, wrinkled or smooth, and whichever way. As they do that, they are regulating the temperature of the testis because the testis needs a specific function very well. So in effect, the cremaster muscles and the datus muscles work in synergy. And then once they relax, then once they relax the datus muscle is relaxing, it becomes smooth, and then allowing more heat to go off. All right. So it means that the place they are is very hot. In that case, too, then the cremaster muscle to also relax. Once it relaxes, then it is causing the testis itself to also lower, to move further away from the body. So by that way, it means that when the environment is too hot, that is what will happen. So the cremaster muscle and the datus muscle, they work in synergy, trying to control the position of the testis within the scrotum, so that the temperature doesn't go too high or too low from the optimal temperature. I hope I've made myself clear. All right. Yes. Next slide. So the testis, like I said, testis, TS is plural and TIS is singular. And then when we talk about testicles too, it's just a combination of the two, but we are not going to be too strict. So if you are saying testicles and say testicles, I mean, nothing is worrying, but just want you to know that there's a little difference between the two, testes and testicles. So the testicles is the male gonads, okay? And then it's a site for production of and development of the sperms. Production of sperms is called spermatogenesis. And it happens within the testes. So that is it. And you see, the primary function of the male reproductive system is to produce sperms. So if the testis is the one which produces the sperms, then we consider the testis as the primary organ. So the primary organ of the male reproductive system is the testis. That's as simple as that. And it's also external. So you can call it external primary organ, something like that. All right. So it is also the site for androgen. Androgen is the male sex hormones. So androgen is all about male sex hormones. And of course, it's the testosterone. So if you are, of course, we are talking about andrology, study of this thing, then you know that it's all about the male sex organ and then the hormones they produce and so forth and so on. Next slide, please. So, all right, okay, all right. So, right, like I said earlier, the testes begin their development high in the abdominal cavity, near the kidneys. Okay. During the last 2 months before birth, or shortly after birth, they descend to the inguinal canal. I'm sure all of us know about the inguinal canal. All right. So if a baby is born, I'm sure one of the first things that if a male, you want to find out whether the testes have actually descended. If they have not descended, you give it a little time, it may descend. If after a while it does not descend, that's also another condition we'll talk about later. That's undescended testicles, which we'll talk about. But the testes develop up there in the abdomen, and then before birth, they have to descend into the scrotum. All right. So then this is an important lesson I've talked about already. Although locating the testes outside the body appears dangerous because it means that the testis is vulnerable to injury. However, that is to provide a temperature which is optimal for the production of spermatozoa, which is about 3% lower than the normal body temperature. This lower temperature is necessary for the production of viable sperms. All right, so I think we said a lot about this already. Yes, next slide. So the internal structure, right? So the testis itself, all right, has an outer lining or covering. It's called tunica abugenia. Okay, so that is like an orange, especially the yes. If you pull off the covering. All right. So I'm sorry. The type of orange you call it tangerine. You will see that all right, you can envisage tangerine, that kind of orange. You see that if you remove the outer coating, all right, then the normal orange, you see that it's like the covering outside is caving in. We call it invagination. So once it caves in, you see that you can remove them. I don't know how to, but I want you to imagine it. If you pull up the tangerine, I'm sure all of us have seen tangerine before. If you see that you can pull them apart and remove them as single lobes. That's all about how this thing looks like. The testes look like. So the outer covering caves in. We call it invagination. Okay, and you know the vagina, you need to penetrate. So that's how it is. So invagination means it is moving in. All right. So it creates lobes. All right. And each of the lobe, when you take one testis, we have about 200. In fact, it's between 200 to 400 lobes, and the average is around 250 lobes. Lobus. When we say lobus, the word L-E-S or U-L-E-S, I mean the suffix means smaller one. So you can talk about tube and tubules. Okay. So lobe and lobus means that it's not a big thing, it's a small lobe. So that's why we call it lobus. So, and for each of the lobes or lobus, it has some coils in it. All right. That coil is also a small tube, a long tube, which has been coiled. So it's also called tubules. So the name itself is called seminiferous tubules. So you have the lobes, the lobes. If you take each lobe, you will have the seminiferous tubules, which form the lobes. All right. So within those lobes, you have the seminiferous tubules, which is actually the major component of the lobus. The seminiferous tubules as the lobus. Now, there are special cells in there, okay, which we call the germ cells. So the germ cells are those ones that are going to produce sperms. So you can link the SS together. So the germ cells are those that are going to produce sperms, and they're in the seminiferous tubules. Okay, something like that, so that you can always link them up. So please move to the next slide, please. All right. So we will, as we move further, we will look at how sperms are produced properly. But I just want to say that when you talk about the seminiferous tubules, you are going to get the sperm cells, and their own differentiation is just like when you have hematopoietic cells. You will start with stem cells that are undifferentiated. All right. So the spermatogenic cells are undifferentiated cells. So, and for any undifferentiated cells, you have them dividing. Some will remain, some will progress, and some will remain. All right. So that's how it works. So the germ cells are part of the seminiferous tubules, and seminiferous tubules are where you have the sperms being produced. And you also have special cells called Sertoli cells. So you always have to remember the SSS. So seminiferous tubules have the Sertoli cells. Okay, and then they are also the ones that produce the sperm cells, right? Now, because we say they are tubules and they are coiling, you see that when tubes are coiling, you have the in-between, there are some in-between spaces. So those in-between spaces, we call them the intertubular space. There's a tube. If there's a tube and you are coiling them, okay, you see that as they coil, there's a space in between. That's the intertubular space. And that intertubular space is also called interstitial space. And because you're dealing with tissue, it becomes interstitial tissue. So those are some of the things that you need to understand. So the interstitial tubules, the interstitial tissue, okay, like outside the seminiferous tubules. Okay, I would just want you to, let's go to the next slide, and then I don't know whether you can get to the next slide for me, please. Okay, so you are seeing the seminiferous place where the listen is. The arrow is, you can put the listen there for me. You can put the pointer there for me. All right. So where where you have the coils, the spaces in between are become intertubular spaces. So those intertubular spaces are also lined by type of cells we call Leydig cells. And then the cells within the seminiferous tubules are the Sertoli. So I'm saying the Sertoli cells are in the seminiferous tubules and they produce sperm cells. So when you run them like that, you will always never forget. And then within the interstitial spaces, you have the Leydig cells. All right. Okay. So let's move on to the next slide. All right. So this is just another pictorial presentation of the whole thing. So you have the tunica abuginea, which is the covering, and then we have the septa, which is the outer covering, which is moving in to give you the lobes. And then the lobes, you have the coil tubules and the seminiferous tubules, and the seminiferous tubules contain the Sertoli cells, and in between them you have the intertubular or the interstitial spaces that also have the Leydig cells. All right. So, ladies and gentlemen, this is just the beginning or the introduction of our 8-week-old or 8-week-long course. Move to the next slide. I don't know whether there's something there. It's just by way of introduction. So, all right, sorry. So we'll be talking more about the other structures. And then once we are finished with the other structures, then we move on to their functions. And then we move on to the conditions that affect them before finally we move on to what do you call it, the semen analysis itself. So we have a long way to go. I'm hoping that, like I've said, we are doing more advanced work. So you may be hearing a lot of things that are not too familiar with you, but I'm sure that as you listen to me and as you also go over the presentations, you can appreciate them the better. So on that note, we bring today's lecture to a close. Hopefully by tomorrow we'll continue. Any question? Okay, so when we are done with the presentations for the week, then we upload them, or you want them after each presentations? How do you want it? I'm not hearing anybody talking. Oh,
presentation, please.
After each presentation, Grandpa.
okay. All right. On that note, we bring today's lecture to a close. See you tomorrow. Thank you.
Thank you very much.